Good morning, everyone. This is Bill Miles with the Hilton Head Island Bluffton Chamber of Commerce, and we're so glad each of you have joined us again today. And we want to give a shout out to the Beaufort County Channel for continuing to provide this timely and relevant information to all the listeners, as well as those who were watching and listening on social media as well, and then to each of you that are on the call this morning. So thank you. You know, the college football power rankings came out, and I know college football fans across the country are watching to see how that moves in the next couple of weeks, but also found it interesting that today the Heisman Trophy, which was awarded on December 9th in 1935, 85 years ago at the Downtown Athletic Club. This was the first time it was presented, and so that's a piece of history going back and looking back at halfback Jay Berlonger from the University of Chicago, who won that first trophy that was later renamed the Heisman Trophy. Just a little bit of piece of history for you, and especially for football fans, as I know that it's important these days as people watch. But even what's more important, we're 16 days away till Christmas, hard to believe. And then we're all looking forward to ringing in the new year, and probably more importantly than ringing in the new year, it's ringing out 2020. And we're optimistic certainly about what we're going to see in 2021 and how we can get things back a little bit to more pre-COVID normal. And then who's counting but the RBC Heritage? I was checking yesterday and excited that the 124 days from today will be the kickoff of the RBC Heritage. So all in all, it's not that far away, and spring is on the way after we get through this wonderful holiday season. You know, I think we can all agree that on all fronts that it's been quite a year, and we just released our annual report, which takes a look back on all the things that not only the Chamber of Commerce has done, but also what the community has done. And I think that you will find great interest if you go back and watch that video that we put together, and I would encourage you to take a look at that. And as a community, what's been accomplished is pretty amazing. We just need to pause for a little bit and reflect back on 2020 and some of the positive things that have happened, along with many of the challenges that we've all come up against and face. So take a look at that. Kelly's placing that in the chat box right now, and take a look at that when you get a chance, and don't hesitate to share it with any of your friends. We'd be delighted for as many people to watch that as they can. In just a moment, we're going to hear what's happening in Bluffton. But before that, certainly want to give a hats off to the town of Bluffton for hosting their first ever reverse Christmas parade last Saturday. The annual Christmas parade, certainly the ultimate Bluffton tradition, and they got creative and made it work for 2020 with the reverse parade. And so congratulations to all those who were involved that helped make that happen. Our first speaker this morning, we're delighted to have, and we thought she would appreciate a little time on the job and settling in Bluffton before joining us for one of our Tele-Town halls. And we're delighted today to have Bluffton's new police chief, Stephanie Price, with us. And she was sworn in on October the 12th, and we're glad to have her in Bluffton. We're glad to have her in South Carolina, and looking forward to her leading the Bluffton Police Department. Chief Price comes to us from Savannah, where she served as the Assistant Chief of Police. And prior to that, she spent 20 years with the Kansas City Police Department. So you can see certainly brings a wealth of knowledge, a wealth of experience to the town of Bluffton. And we're so appreciative to have her leading as the police chief, and also with the experience that she brings. So Chief Price, we're delighted to have you with us this morning. Thank you for taking time to join in, and we look forward to hearing some thoughts from you this morning.
Well, thank you very much for having me. I certainly thank the Chamber and the community of Hilton Head and Bluffton for inviting me on your town hall call. I'm more than honored that you think that the town of Bluffton and I deserve a little bit of your time. So thank you very much.
You're welcome.
Thanks. So I assume everyone wants an update on what's going on with Bluffton and kind of where I've come from and where we stand at right now. So I know that you'd already mentioned the reverse parade, so I would like to talk a little bit about that. But before I do, please let me start by saying I have been nearly overwhelmed coming here. And when I say overwhelmed, I don't mean by the job itself, but I mean by the welcome of the citizens of Low Country. You know, today I heard a saying, and it said it was a small town with a big, big heart. And that's absolutely it. If heart was a place, Bluffton would certainly, and the Low Country and Hilton Head would be the capital of the United States. I have never been so greeted, so warmly welcomed in a place, so well wishing. So just thank you very much, community, for making me feel that grateful to be here. I am very humbled to be here, and I am very grateful to be a part of your community, and more than pleased to be your new police chief here. So I just want to say that quickly out the start. We have a lot of great things going on here at the police department. When I started, it was about 2 months ago. So when I started, it was about Halloween time. So we got together and had a reverse Halloween where we actually took candy to the kids because of COVID and because of all the restrictions and all that. So as safely and sanitarily as possible, we took candy to the kids. So community service here in Bluffton is really big. It's one of the major reasons that I wanted to work here is because I do love getting out in the community and talking to everyone. So if you see me out and about, please raise a hand high. That would be great. And our reverse Christmas parade. None of us quite knew how that was going to go, but again, more than pleased to say that that turned out really well. The only thing that I will say is from waving at everybody, my arm did get a little sore, you know, just so you know. So I'm very pleased on how that turned out, and I know the town is very pleased. Town council and the mayor talked about it, and they talked about how exactly well that went, how smooth running it was, and how safe that was. So that was really nice. Gotten to see all the little kids and the cars and all the families bringing people from all around and talking to them. So I was very pleased about the Christmas parade. But in Bluffton here, we're concentrating on the police department. So the first 60 days that I've been here have really been getting to know, you know, not only the citizens, but the structures of the police department and how kind of the organization does. So just really learning exactly what the culture here is at the police department and learning what's been done and where we can go in the future. So we've been getting together and developing some goals that we have, and you know, we've identified areas that we really need to focus on, not because they haven't been focused on, but because that's where, you know, policing and law enforcement is going. So of course we've been developing, you know, community partnerships, again, something that the Bluffton Police Department is really great at, but we're just looking to further those community partnerships. You know, we have the Citizens Advisory Council, and really that's just a group of citizens that are helping Bluffton be better, helping Bluffton PD be better, and helping connect the community with the Bluffton Police Department, and helping us guide our practices. And really more than that, it's expectations from the citizens. You know, we all think we know what people want from us, but until we actually get together and we talk about realistic expectations and what's going on and what we can deliver and what they can expect, that's really what the Citizens Advisory Council is about. I'll be attending my first meeting on that this week, since it was started before I was sworn in. And what we're looking for in the Citizens Advisory Council and the way we're going to guide our meetings and really guide our purpose is through the President's 21st Century Policing. So just so you know, that's going to be the guide, and the pillars of that are going to be the guide for our Citizens Policing Council. So not only making community contacts, one, but we're also talking internally about what we can do to make our organization better. And one of the things that we're talking about is training, of course, leadership, and accountability. And although those are big words and they're big buzzwords, what we really mean by that are things like leadership. We're talking about mentorship. I talked to him about, you know, we're not making our police department now, we're making our police departments for the future. So what do we want the future, working with the citizens, what do they expect the future of Bluffton Police Department to look like? How are we wanting to interact with the community? Along with the future of our police department also goes our training and recruitment and retention. So not only do we want the best for Bluffton in the Low Country, but we want to provide you with the best officers that you have so you can lead our future. So just a few of the things that we're working on here in the Bluffton Police Department.
Chief, thank you. And your passion is certainly contagious. And we're so delighted to have you with us this morning. We've got a couple questions that are coming in from our listeners. If you have time to take a few questions.
I certainly do. I could talk forever. I love this community already. I always have, though. I've always been a fan of Bluffton, but go ahead, sir.
Well, that speaks volumes. And while you're certainly the best choice and the right choice to lead the department. The first question's coming in from Ray, and Ray is asking about the Bluffton Police Department toy drive. If you could share some information on that.
So absolutely. So Bluffton Police Department has always partnered with the community and Bluffton Self-Help to be a conduit for toys. And this year we're doing, which we've done in years past as well, but we've also asked our SROs to identify needy families within the school systems. And so our SROs are coming up with families that we can actually deliver toys to, and as well as a couple of our patrol teams are coming up with folks and families where they may have encountered them, that we can deliver toys to them. So if you could please bring your toys, new toys, to 101 Progressive Street. Our lobbies are open from 8:30 to 5:30 Monday through Thursday, and 8:30 to noon on Friday. We'll be more than happy to accept toys from you, and we'll distribute those between Bluffton Self-Help and the families that were identified by our officers.
Thank you,
and
Chief.
We are in need of toys as well, too. So if anyone has any extra, please bring them by.
All right. We'll certainly help get that word out as well. Another question from Leanne, and Leanne is asking, what are a few of your top goals for next year?
Oh, this is good. A few of our top goals. So we're currently trying to work with more community-oriented projects. And what I mean by that is we're getting our officers more in tune with the actual kinds of calls that are going on out there in the community and the community needs. And what I mean by that is this. When we go on a call, it may be a disturbance, but we're talking now about what the actual root cause of that disturbance is. So before the end of 2021, we look forward to having over 50% of our staff certified in crisis intervention training, so we can know exactly what we're looking at when we get there, how to deal with folks in the most effective manner. We're also looking at maybe delivering some sort of social programs to them, and there'll be more to come on that.
Okay, thank you. Steve is asking if the police department has resource officers in our local high schools.
We do. We have resource officers in the high schools. And as a matter of fact, I just took a tour of the high schools not very long ago. So I do appreciate those. And you all are growing so big. You know, May River High is already, I think they said it was either 4 or 6 years old, and they're already adding additions onto that. And I went and toured around that. And that school, if y'all haven't been, is amazing. They have an automotive program in there. They have a welding program. They have nursing programs for the students to go in. I'm very impressed with the quality of not only instruction, but the quality of materials and equipment they have for our high school students.
Thank you. And Kay is asking, how many officers are patrolling Bluffton at any given time, if that is information that you can share?
Oh, I can absolutely share that. So we have, we call them FTEs here. So we have 59 FTEs. So your full force of officers when we're fully staffed is 59. Right now we're lacking about 5. So we are hiring. And by the way, thank you citizens who weighed in on our new hiring slogan, because we actually had a contest on Facebook to see what our new hiring slogan would be. And that is serve with pride and live with honor. So thank you all who participated in that, because that will be our new slogan going forward when we advertise to folks about recruiting and hiring. So at any given time, particularly during busy times, you have about 15 officers that are available to answer calls, but that doesn't also mean a couple things. Just because you have that many officers at any given time answering calls, they could be in the office and, you know, investigations, they'll still go out and answer calls. Our traffic unit, we've started a traffic unit since I've been here, still goes out and answer calls. If someone needs help, we will all go help. And I know our surrounding agencies will as well.
Okay, sorry about that. Our next question is is coming to us from Jim. And Jim is a statement saying, we're so grateful for our police officers. And then the question piece of this is, how do you feel officer morale is doing based on national issues happening on that front?
So officer morale here in Bluffton is a little bit different than in the rest of the country. You know, I come from different areas of the country. Kansas City is a major city in the Midwest. And I've got to say officer morale here is better. So because the community here so appreciates the police department, because the community here is so supportive of the police department, there are a different kind of morale. Morale here is they do for the community. As a matter of fact, during COVID times, and even during when I was here for Halloween, I wouldn't say that they were upset, but they were a bit disheartened when they thought that we weren't going to be able to interact with our community and give the kids the candy. That's why we came up with the reverse Halloween, so we can get our, you know, officers out there interacting with the community. That's what they like to do. That's what you join the Bluffton Police Department for, is to interact with the citizens. When we say protect and serve, we live protect and serve. So much so that, as a matter of fact, we use that in our advertising. Come to a police department where the community appreciates you. Come to the police department where they are so supportive of their police that, you know, you'll be making a difference instantly.
All right, thank you for that. And if you could outline 2 or 3 things where the community that you would like to see the community support your officers in your department, what would be a couple of those things that maybe you haven't mentioned yet?
We really do, when we call upon the community to help us with things like, well, what's our advertising slogan? What do you think about the Bluffton Police Department? You'll be noticing that we have a little bit more of these surveys going out so we can actually ask our community. But when we have neighborhood watches, please participate. If you need a neighborhood watch started, please call the police department. We will help you start a neighborhood watch. We're really, you know, big into that. And I just, you know, it really is so heartening to be in a community where they appreciate you so much. As a matter of fact, I have a little story. My son and he's, I suppose he's an adult. He's 18 years old. He'll always be my little boy, but we were walking down and he's like, why are all these people talking to you, Mom? Why are all these people saying hi to you? I said, baby, that's how it is in Bluffton. Baby, that's how it is here, where everyone's so genuine and welcoming to you. So we don't get that everywhere in the country. So I want to thank you very much for that support, just so you know.
Oh, thank you. Thank you, Chief. And certainly the serving with pride and living with honor is something that we can all do in our own personal lives as well. That's I think that's really very good, something to live by. And again, we just appreciate your leadership, your commitment to Bluffton, to the region, and for joining the department. Bluffton and the surrounding areas will be better because of your leadership and your involvement. So thank you very much for joining us today, Chief, and congratulations on your new role. And we know that you're going to do very, very well.
Thank you. I really appreciate it. And anytime you want me back, just let me know, because I really do like telling you what's going on with the Bluffton Police Department, because it is your police department.
We see that. It comes through. It's genuine. And thank you very much. Have a great rest of your day.
Thank you. Happy holidays to everybody out there. And don't forget, stay safe, be well, watch out for each other, and help your neighbor.
Thanks, Chief. Great having you with us.
Bye.
That was Bluffton Police Chief Stephanie Price, and what a delight she is, and great things ahead for she and her department. Our next speaker this morning has some exciting news about to relay on the town of Hilton Head Island's latest and largest investment project. And Josh Gruber is back with us this morning, and glad to have you joining us today. And that plaid jacket looks great in the background, Josh.
I thought you might appreciate that, Bill, and thank you for having me on this morning. We are very excited to talk about an event that we have coming up for tomorrow. At 10 a.m., we're going to be doing a virtual ribbon cutting for the new Celebration Park. As many folks know, that's been a couple of year undertaking. Actually, from the planning stages, it goes back almost 20 years, but it's been under construction for the last 2 years. And so we are really excited to see the fences coming down and are really looking forward to being able to invite the public to come out and enjoy this new community amenity. So at 10 a.m. tomorrow, you can go on to Facebook for the Town of Hilton Head Island's website. I know you all, I believe, are going to have it on the Chamber's Facebook page. We're going to have it on the county channel and a couple of other different places where people can watch this virtual ribbon cutting. And then immediately following that, we would encourage folks to go out and explore this new park. There is so many neat features that are out there. People are really going to be excited about. And we can also tell you that in talking with the Sandbox folks, they are still working on their building. They've always been kind of about 60 to 90 days behind the construction of the rest of the park. And so they are still on track right now, I believe, to be open sometime right around February. And when that happens, that's just going to make it even more of a special place for people to come visit.
Thank you, Josh. Thank you for that. As far as events being able to take place, when are you expecting that after the new year that might happen?
So with this particular property, we will likely look to sometime later on in the spring. Folks that'll go out there will see that the sod that's laid down out there is still somewhat fresh. And so we certainly want the public to come out and enjoy it, but we're a little hesitant to have some of the large organized gatherings at this particular location just yet. But we're hopeful that by the time we get to the spring, we might be in a better position to start looking at having some events and festivals in this area. And I think people, when they go out there and look at it, they'll be able to imagine in their mind's eye what some of these things are going to look like and how neat of an opportunity it's going to be to experience them in that setting.
Josh, thank you for that answer. Tom is asking how much parking is in the new park.
So we did add some additional parking on the perimeter of this property. And then again, you've got the Coligny Beach parking lot immediately adjacent to this property. So between those two, I believe we added somewhere in the neighborhood of about 60 parking spaces from what was previously there just with the beach parking lot.
All right, thank you for that. And the Sandbox, any idea of when the Sandbox might be having its opening?
Yep. So in talking with them just as recently as a couple of weeks ago, they're making a lot of great progress on upfitting the inside of their building. One of the things, they've got a full-size cockpit from a Gulfstream airplane that actually had to have been brought on site and put in place, and then the building built around it because of how big it is. So they've been working for a while now. It's looking like they should be completed with those upfits sometime right around the February timeframe.
And Josh, the overall investment from the town of Hilton Head Island on this project, how much would that be?
So from the park itself, and then also some of the roadway improvements, Tanglewood, and then also at Pope, when you add in the cost of the roadway, drainage, and then the park improvements themselves, all in, it's right around $20 million.
Josh, certainly a big commitment, and it's been a labor of love for you and Steve Riley and the entire team and staff there on Hilton Head Island. And we just thank you all for bringing this to fruition, and for this council and previous councils that have supported it along the way. And we're looking forward to it being a new great asset for all of us in the area.
Absolutely. We'll look forward to seeing people attend our virtual ribbon cutting tomorrow morning at 10 a.m. And then we'll hope to see you out in the park sometime real soon.
All right, Josh, thank you very much. Thanks for being with us.
Thank you.
And again, that virtual ribbon cutting, you can find that on our Chamber's Facebook page tomorrow. And Kelly has placed that invitation and information in the chat box. And please tune in. It's an exceptional park, and one that I think we'll all be very, very proud of. Our next speaker this morning is someone that's no stranger to us, and we're certainly indebted to her for her time coming on each week and updating us on the current situation with the pandemic. And Dr. Jane Kelly, we're delighted to have you back with us today to share some information and some helpful hints.
Thank you. I'm just unmuting and let me see if I can share my screen.
It's beginning to look a lot like Christmas in your background.
That's right. You know, I'm aware of the fact that you can blur out the background or put in a fake background, but I've enjoyed these Zoom calls where I see where people live and what their lives are actually like. I mean, it just makes, it fulfills that need for human contact. So I hope you don't mind when my husband walks through or the dog starts to bark. But anyway, COVID-19 update. I always start with the trend lines, and the trend lines continue to be concerning. So here it is for the United States as a whole, and you can see that huge surge after Thanksgiving. And especially, not just this is showing number of cases, but I would draw your attention to the number of deaths, and that over the last 14 days, there's been nearly 50% increase in the number of deaths nationwide. South Carolina is not in as bad a situation as many other parts of the United States, but we shouldn't be too reticent about that. We shouldn't feel too confident, because we do have a more than 50% increase in the number of cases. We are seeing the effects, I think, of Thanksgiving, and there's concern going into the Christmas season. It is true that our hospitals are not overwhelmed. Most of our hospitals are functioning at about 80% bed capacity. But again, I would urge that it's not just beds, it's people. And I think our healthcare workers are very stressed, and the most that we can do to reduce stress for them is all those mitigation measures until we have enough people in the country and in South Carolina vaccinated. I do want to look at some numbers a little bit differently. For example, as we talk about the number of deaths, this is a disturbing statistic. This is specific to South Carolina, that if you look at the causes of mortality for the past week, from November 30th through December 6th, COVID-19 was the #1 cause of death in South Carolina. It outstripped heart disease and cancer, #1 cause of death. The other way I wanted to look at some numbers is to look at this snapshot from yesterday's statistics from our DHEC website. We've done almost 3 million total tests in South Carolina. And I want to draw your attention to the percent positive. I think we've talked about this before, but just a reminder of what that means. So when not only DHEC, but all the labs, all the other mobile clinics, healthcare providers, CVS pharmacies, et cetera, when they do testing, whether that's the PCR testing, the nasal swab testing, saliva testing, antigen testing, all of those results come to us. And we look at the total number of results and what percentage of those results were positive. Ideally, if you were testing enough people, you would like your percent positive to be about 5%. Now, maybe that sounds inefficient, but what that tells me is if you have a very low percent positive, that means that you are screening enough people to feel confident that you are finding all the asymptomatics and getting them to isolate so that you don't spread disease. The fact that almost 1 in 5 people yesterday tested, of those who tested positive, is cause for concern. That makes me think that there are a much larger number of people out there in South Carolina who are infected, contagious, and maybe are asymptomatic or just have mild symptoms. Again, especially around the holidays, where people are more likely to have been inadvertently exposed, we encourage people to get tested as a regular basis, not just certainly get tested if you have symptoms, but to also consider getting a routine test just as a screening test now and perhaps every 1 or 2 weeks. I know that's frequent and that's a hassle, but it is concerning going into the holidays. You don't want to be infecting others. It'd be better to find out now. I keep getting reports of people who are surprised. They get tested, they had no idea, can't imagine where they were exposed, but nevertheless tested positive. Here's the 7-day moving average by public health region around the state. And the low country is that light blue bar. And yes, congratulations, you're still down at the bottom of the graph. You've got the lowest number of new cases, but there is an uptick. Here are the exact numbers that I presented last time. So this was cases and deaths in the last 14 days last week. I just wanted to show you this as sort of keep some of these numbers in your mind. Okay, over 2 weeks in South Carolina, we had 9,000 new cases. In 2 weeks, Beaufort had 232 new cases. Now let's look at what's happened in the last 7 days. In the last 7 days, we've had an increase of over 34,000 cases in South Carolina, an increase of 910 cases in Beaufort. Remember last time, over 2 weeks, it was about 100 a week. Now it's 900 a week. So there is a surge going on. It's the same message around masks, but just to remind a few other things, the maintaining social distance is still key, even outdoors. There is transmission. It's much safer outdoors versus indoors, but maintain your distance outdoors as well. Avoid large gatherings. But I want to focus more on the identify and isolate cases. We are trying to rev up testing to try and identify people early. And there's an additional reason for identifying people early. There's treatment available now for early infection. If you think you may have been exposed, or you traveled, or you got together with non-household friends or family, get tested, not just for all the public health reasons I identified, but also if you were infected and maybe you're at increased risk for severe disease, maybe by age or a medical condition, or you're worried about contagion and spreading this to household members, there is a new medication. It's a monoclonal antibody. These are antibodies that are made in animals, but they're safe for use in humans. This, for example, this bamlanimab is the one that was given to Chris Christie when he became ill with COVID-19. It is now approved. It is available at the Beaufort Hospital as well as many other locations around the state. So your reason for getting tested is to provide safety by isolating safety to others, but also you may be interested in getting treatment for early infection. It has been proven to lessen the severity of infection, but it's got to be given early. If you wait until you're very sick from it, it's too late for these antibodies to work. All right, my recurring series of Do Masks Really Work? I'm going to tell a little bit different story this time. And this is a story around the city of Beaufort, because I am very pleased to see that the city council met to discuss whether to continue the mask ordinance. And I participated in listening in on that town hall session. And there were some really heated public comments that were very angry, more than just frustrated and concerned, that were angry, almost threatening to the members of the town council around continuing that mask mandate. But I am proud to say that they stood their ground and cited the data, cited the evidence base of if CDC and DHEC and all these other, there's consensus around masks prevent transmission, then they unanimously voted to maintain that mask ordinance. And my hat is off to them for doing that. That's kind of a brief presentation this time, but I'm happy to take questions. I know we've got vaccine on the horizon and people may have questions about that.
All right, Dr. Kelly, thank you so much. Several questions this morning. The first one's coming from Mark, and Mark is asking, what is the current possibility of us getting rapid in-home testing? And then the next part of that is, how do we advocate for that?
Sure. So there are a number of different tests. One of them, though, is a saliva test, and that saliva test is available now as a test that you can do at home. You can, I'm not certain where it is available. It is available at pharmacies, but I think you'd have to check with your local pharmacy to make sure that they have the saliva test in stock. I know you can mail order it. And it is available through DHEC, but again, I'm not certain if it's available at every individual local health department. You would have to call and check to make sure that they have it. Even if they normally carry it, they might not, they don't have infinite supplies. But that's one possibility that is available now, the in-home saliva test.
Okay, thank you for that answer. And then his next question is, what is your impression of our ability to obtain and administer the vaccination?
So what we know thus far, there are two vaccines that are imminently on the horizon: the Pfizer vaccine and the Moderna vaccine. The Pfizer vaccine is the one that's being reviewed and might get emergency use authorization on Friday of this week. If it is approved, and we think it would be available to South Carolina as early as Monday of next week. However, we know we're going to get very limited supplies initially. The US government has already pre-purchased 100 million doses of the Pfizer vaccine and the Moderna vaccine. The Moderna vaccine emergency use authorization meeting is on December 17th. And again, from everything that we understand, we anticipate that it will be approved and then would be available to South Carolina starting around Christmas week. But both of those, although the US government has purchased 100 million doses of both of those vaccines, for an initial rollout, that rollout goes out to all the states and territories. In South Carolina, we have been told that we will receive before the end of the year an estimated 200 to 300,000 doses of vaccine. Obviously, that's not enough to vaccinate all of South Carolina. That's not even enough to vaccinate all of our healthcare providers or people living in long-term care facilities, nursing homes. But it's a good start, and then we will get vaccine on a weekly basis. And as we get increasing supplies of vaccine, we'll be able to start phasing in more and more groups of people. Our current thinking is the most critical place to vaccinate first are the healthcare workers who are taking care of critically ill COVID-19 patients for two reasons: to protect them, but also to protect the system. If they're out ill, honestly, hospitals are going to be overwhelmed. But after that initial rollout to people in nursing homes who are at most risk of death and those healthcare providers, we'll start making it available to those who are most vulnerable to severe disease: people over age 65, people with various chronic medical conditions such as diabetes, but also essential workers such as people who work in utilities or waste management. And as we get more vaccine, and we anticipate in the first quarter of 2021, we anticipate we'll be getting much larger doses of vaccine. We'll hopefully have both Pfizer and Moderna and perhaps AstraZeneca by that time as well, that we would have enough vaccine that we can roll it out to the general public. So, as I've heard Dr. Fauci say, the cavalry is coming, but hang on, this is a really critical time right now. I hope that answered your question.
Yes, thank you. Next question is from Marty. And Marty is asking, what's the difference in accuracy from the rapid test to the other type of test?
Excellent question. So there is a difference in accuracy. The PCR test, the nasal swab test, but there's a PCR test, there's a saliva PCR test also. So the PCR tests come as a nasal swab, an oral swab, and saliva. Those are estimated to be 98 to 99% sensitive, meaning that they are highly likely to pick up virus if you are infected. If it's extremely early on in infection, maybe they will miss it, but they have a very low false negative. The rapid tests are different. The rapid tests, because they don't amplify, they don't multiply the virus to look at it in the machine, they only look for a certain protein. They can be as low as 80% sensitive, which means they're going to miss 1 in 5. So they're good if you need an answer immediately. But if you have symptoms and you have a negative rapid test, I would not trust it. I would make sure I got that PCR test.
All right, thank you for that. Next question is coming from Thomas, and Thomas is asking, how are we doing with the flu this year? Is masking helping that as well?
I think masking is making quite a difference. I know people are irregular about adhering to wearing masks, but any masking is making a difference, because we have so far this year, and of course we've still got a ways to go in flu season. So far, our numbers statewide are quite low for influenza. So keeping our fingers crossed.
Thank you. And Taylor is asking, is there a possibility the U.S. will have shortages based on vaccine demand from other countries? You touched on that a little bit already.
I don't think we'll have shortages. I think there's going to be a delay in rolling out vaccine, because it's true, the U.S. government bought 100 million doses of Pfizer and Moderna, and it's important to remember that they invested in that not knowing for certain that those vaccines were going to work. That's why they invested in both of those and also some other vaccines. Like I mentioned, other companies, AstraZeneca, Johnson & Johnson, Novavax, those vaccines are all in phase 3 trials right now as well. So they may become available in 2021. So I think that was good thinking on the part of the federal government to buy vaccine from, don't put all your eggs in one basket, to buy vaccine from all these different companies. But it's true that they can't buy more immediately because some of that vaccine has been sold to other countries. But I wouldn't phrase it as a shortage, as more of some delay in rolling out.
All right, thank you for that. Our next question is from Jennifer. And Jennifer is asking, when vaccines are available, how will ongoing assessment of antibody levels be evaluated? Specifically, how will we know how long immunity lasts?
We have some information from the phase 3 trials that we know that for these two vaccines, Pfizer and Moderna, they are 2-dose immunizations. You get the first one, and then either 21 or 28 days later, depending upon the vaccine, you get a booster dose. If people just take the single dose, they get some protection, but we know from the studies that protection, the antibodies you make and your white blood cell reaction, immunity wanes. It decreases quickly. It doesn't last. You need that second booster dose to have longer lasting immunity. From what we know thus far, antibodies, what are called neutralizing antibodies, the strongest antibodies, last at least 90 days after after the second vaccine. And that's ongoing. That we will be continuing. CDC will continue to follow this. The FDA has required these companies that produce vaccine to continue. They don't just stop at phase 3 studies. They continue to measure not only side effects but also effectiveness by studying antibodies in people who receive the vaccine.
All right, thank you for that. Just a couple. Go ahead. I'm sorry.
Well, that didn't precisely answer your question, because I think no one knows yet. They'll be following it. We know that antibody, it lasts at least 3 months, but that sounds like a very short period of time, but that's just because the nature of how long the studies have been going on. We anticipate that it will last substantially longer than that, but this might be a shot where you need to get a booster every year.
All right, thank you for that. Next question is from Joe, and Joe's asking, which vaccine do you recommend?
I would take either one of those as soon as I was eligible for it. I think they have they're very closely related in the platform that they use for developing it. They're both 94 and 95% efficacious, meaning that they're effective in preventing symptomatic disease, and they both have about the same safety profile, which means that they had no serious adverse events, but they give you a sore arm, they feel fatigued, they maybe give you a headache or a low-grade fever, especially after the second dose. Those are temporary symptoms that only last 24 to 48 hours. They're inconvenient, but that profile appears to be about the same for both of those vaccines. I would take either one, whichever one was available to me.
Dr. Kelly, thank you. Our last question is coming from Teddy. And Teddy is asking, I haven't gotten my flu shot yet. Is it too late for me to do so, to be effective?
It is not too late, and I would absolutely suggest getting your flu shot. I know I just finished saying that the numbers of flu infections we're seeing are low, but we are not through flu season at all. I mean, flu season is going to go on through the spring, and you don't want to risk getting flu, especially with COVID around the corner as well. So please definitely get your flu shot.
Great. Thank you again for being with us this week, Dr. Kelly, and we appreciate it as always, and hopefully we'll get a chance to talk to you again next week.
All right, great. Thank you so much.
Thank you. All right, that was Dr. Jane Kelly from DHEC, and providing us being a tremendous wealth of information for us, as she is each and every week. Next week, we're going to have with us the Beaufort County Treasurer, Maria Walls. Don't think you'll want to miss her. She'll be talking about property taxes and payments of those, so you want to tune in for that. Plus, we'll also have a very, very special surprise guest. And just in closing today, I think back to what Chief Price said, and what a delight she is, and delight to have with us this morning. But serve with pride and live with honor. I think that's something that we can all take to heart, and serving with pride and living with honor. And with that, I'd like to close by saying, be kind, stay safe, and wear your mask. And thanks for joining us. We'll be back with you next week. Have a great rest of your day. Bye-bye.